You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Mike Blanchard. We've invited Dr. Blanchard on the program today to discuss spinal decompression for the treatment of neck and back pain. Dr. Blanchard, welcome to the program.
Thanks, glad to be here.
Now, before we get into today's topic, tell us about your practice.
Well, we're in the northern part of San Diego County. I've been there for about 18 years, and we treat people from the ages of toddlers all the way up to the very aged. I think our oldest patient was 94, and we focus on pain relief for neck and back pain specifically.
You told me off camera you're very aggressive when it comes to pain.
That's right.
What do you mean by that?
Well, I just mean that almost everybody that walks in the door is in pain, and we don't take no for an answer as it relates to pain. We work with a lot of physicians in the community, orthopedic surgeons, neurologists, anesthesiologists, physical therapists, so we take a real team approach to this. So there's always options. I like to say we have more bullets in the gun than the average guy. We can treat a lot of different conditions very successfully with this approach.
So is it fair to say, and we've talked a little bit off camera, so more than just the traditional, what somebody would think of as traditional chiropractic.
Right.
Is what you're doing.
Exactly, and specifically with non-surgical spinal decompression. It's a relatively new advancement in the treatment of pain, specifically back and neck pain, sciatica. It treats herniated discs and bulging discs, which up to this point has been difficult to treat. The options available currently, or I should say prior to decompression, have been physical therapy, chiropractic care, epidural injections, and surgery. And now we have decompression, which really moves to the front of the line in terms of the treatment of these conditions because it's the least invasive therapy that you could possibly do. And statistically, it has by far the highest success rate.
Okay, now I invite you on the program to talk specifically about spinal decompression.
Right.
And I told you, I'm very skeptical.
Yes.
And with chiropractic in general, it's one of those things that I know very little bit about.
Yeah.
I mean, I know the basic concept. So why don't you, let's start there. How does it work? And then where does the machine play a role?
Right.
And what are you actually doing that is affecting pain?
Right. Okay. Well, how the machine works is if you think of it like traction, everybody can relate to traction. It's pulling.
Okay.
But traction is archaic. Traction is a very generalized process.
You don't like traction?
Well, I do like traction for the general relief of minor pain.
Okay.
In certain conditions, it's very useful, and we actually use traction as a follow-up to decompression in many cases.
Right.
But the difference is that traction pulls in a general sense. It pulls a lot of vertebrae at the same time. So if we were to traction your lower back, you would be pulling everything in your lower back and not have the ability to focus it on a specific segment.
You're saying you could target with this
That's
machine.
exactly right. We can target a specific disc. So we look at an MRI. We see that the L5 disc is herniated. We can focus 90% of that pressure, or tension I should say, on that disc and not be affecting the other areas. So it allows us to pull harder, unbeknownst to the patient, because it's very comfortable, but that allows us to get the negative pressure, which draws fluid in, draws the herniated material back toward the disc.
Help me understand. Okay, so this bulging disc.
Right.
I mean, what's it good for, by the way, this machine? Is it herniated disc, bulging disc?
Yes, both of those.
But just because you're stretching it, the part I don't understand
Sure.
is, again, how is it just by adding more fluid to the disc itself?
Well,
I mean, how is it working?
It's the negative pressure.
Okay.
That's the bottom line. So negative pressure, think of it like sucking through a straw.
Okay.
It's going to pull fluid from the bottom of the glass up the straw and into your mouth, right? Mm-hmm. So the negative pressure inside the disc pulls the material that's bulging out or leaking from the disc back into the disc. And they've documented this on pre and post MRIs, where they've seen as much as a 50% reduction, or in some cases 100% reduction in the size of the herniation or bulge.
Are there those patients that have failed drug therapy, that think they've tried everything? You know, the classic story. Then they go to you,
right,
put them on the machine, and they're better.
Exactly.
There are those stories.
We've had a lot of those stories.
Okay.
Yeah, and I'll give you an example of one. A patient of mine, been a patient for probably 15 years on and off for various conditions. He's a diabetic. He was at a point where he was on a walker. His back was so bad and deteriorated, and he'd worked heavy construction most of his life and done very physical work and was an absolute mess. So he had the back issues as well as diabetic peripheral neuropathy. So he had numbness and tingling in his legs. And the specialists were confused, as I was, as to how much of this was coming from diabetic neuropathy and how much was coming from the disc issues in his lower back, because both areas were a mess. He finally visited a surgeon in San Diego who was actually contemplating below-the-knee amputation on both legs. because it was getting so bad. He came into the office. He had called me on the phone after receiving some mail from us because we had gotten this device, and called him and said, "Do you think this could help?" And I just had him. We had him come in. We took him through the evaluation, looked at his MRIs, and there was definitely things on the MRI that we could help. So we put him through the process, and within about 7 or 8 visits, the numbness in one of his legs was completely gone. And about 50% of it was gone on the other leg. Now, he completed the 20 treatments, which is what we typically do. And at the end of that, he was off his walker. He could walk without the walker. I mean, it was really one of those cases that you just go,
right?
I mean, it was just amazing.
It was like a miracle story.
It was, yeah.
So what does a guy like to say to you?
Well, he was ecstatic and very appreciative, to say the least. He was able to put this walker away, and we would joke about it as he would leave the office. I said, you know, Ron, you got to hold that cane over your head when you walk out of here and impress some people. Anyway, so the neat thing was that he was able to get back to doing some things that he liked to do. I mean, he couldn't do really anything. He had to sit most of the day. Now he could get up, help his wife around the house a little bit, and get back to his life. And he's, you know, he's had a lot to do, and he enjoys life, and he wasn't able to enjoy it, and now he can.
Back pain, I mean, neck pain, and things like that. How big of a problem is this?
It's a huge problem. I mean, that's why I'm here on this show, is to tell people that there's hope. People have tried a lot of different solutions to pain, and it becomes chronic, and they're not getting the results that they want. They've worked with top-notch surgeons and top-notch anesthesiologists for pain relief and pain procedures and medication. It's not working. And this gives them some hope. It's another option they haven't tried, and it works.
Tell me a little bit about the technology.
Right.
Because, you know, we talked. And,
yeah.
And this is a $130,000 machine.
Right.
I guess not all machines are created equal.
That's
what
true.
makes this so good?
Well, I think the investment that the company put into the machine. There's 2 companies out there that do a great job, and one would be Axiom and the other one is SpineMed. And I think both of those units are top-notch. I think you can't go wrong with either one. But I think it's because of the time and the investment, and they've invested millions of dollars into this thing. And it's
so it targets the area of the back where there's a problem.
Yes.
Okay. Now you brought some models here. Help me understand again what it's doing. The principle of what it's doing.
Right. Well,
I'm not clear.
Yeah. Once the patient is on the unit, they're laying face up on this. They're strapped in comfortably. In fact, most people fall asleep once this thing gets going because it's a 30-minute process. They're on their back listening to nice music, and they're out. We hear snoring. But what it does is it takes the vertebrae and pulls them apart. So we get 5 to 7 millimeters of actual separation of the vertebrae. Now, it doesn't disconnect from the disc. That's just not possible because each vertebrae is firmly attached to the disc. So what it does is it stretches the disc, if you will. And it's that stretching that draws fluid in. It's like a dry sponge that you drop in water. All of a sudden, it starts to bring in fluid. And that's what this process does. So it gets the pressure off the nerve roots, it gets the pressure off the spinal cord, and it's those things that are causing most of the pain, as well as it takes the pressure off the joints in the spine. Okay. Restores physiology and function. I mean, it's
now 20 treatments, you say. Is that spread over how long?
5 to 7 weeks.
Okay, so it's not very long. I mean, 5.
No, it's not very long. It's just very repetitive.
And what kind of pain relief? I mean, I guess in pain management, you have numbers 10 down to a 5.
Yeah.
I mean, what do you hear? I mean, what?
Well, I mean, they come in
see?
all across the board. We rate people on a scale of 1 to 10. 10 being, you know, you want to just lock yourself in a closet and shoot yourself. You're in so much pain. Down to 0, where you obviously have no pain. So most of the people that come in are between a 5 and a 10, whether it be neck pain with arm pain or back pain with leg pain, and they're disabled for the most part. And so what we're seeing is in the successful cases that we have, which I would say is pretty much in the 80 to 90% range, those patients are bringing that pain level down to a 2 to 1 or a 0. Let me tell you what that means in a person's life. You take, for example, a patient I'm thinking of right now, a family man, guy in his 30s, hardworking guy, making a great living. I think he's got 2 kids, small kids, toddlers, and at the level of pain that he came in with, he couldn't do anything. He couldn't help his wife around the house, and she was starting to get a little irritated with that. Although
that's hard to believe.
Yeah.
No,
although understanding of his condition, not able to help at all with the kids. In fact, he couldn't even pick the kids up. And for a dad, I mean, I'm a dad of small children. Sure. You want to pick those kids up. You want to love them, and he couldn't do that. You know, the kid would come over, let's play some soccer. Okay. Can't. And so for him to go back to that, and he wrote this down in a letter to us as well, that his life was changed because of that. I mean, he was so relieved to get back to his family, to be able to play with the kids again, and he could go back to work and work his day without, you know, having to grind through this pain. But when he came in, he was very frustrated, and as we initiated treatment with him, he was still frustrated because results didn't kick in immediately. It took him about 7 or 8 visits before he even started to see a change, and he, on the 3rd or 4th visit, was saying, look, this isn't working, Doc. I think we ought to just cut it right here. And we encouraged him that, look, just hang in there. There's light at the end of the tunnel. And sure enough, visit 7, he comes back in the next day and says, you know what, I slept through the night for the first time and I don't know how long.
Wow, okay.
And it was great.
Now, what are the frequently asked questions? Okay, patients, the pain patients, I guess, know who they are. They're in pain.
Yep.
They're skeptical.
Yeah.
What do they come in asking you? I mean, what are their questions about spinal decompression?
Well, I think one of the things that they want to see is our office, you know, and what kind of office it is, and they want to see the device. You can see them peering around the corner as they walk in the door because we have a door open and you can see the edge of this device.
It's a big machine, I see it.
It is big, and it's computerized, and it's got LED lighting and all this other stuff, so it looks very impressive. And so they want to see it. I think kind of almost like to touch it to see if is this real? Does this really work? And so once that's out of the way, the questions are basically, you know, am I a candidate for this? Can this really help me? And we screen them very carefully to make sure that we are selective in the patients that we take. So we do expect a positive result with everybody that we take in. And there are a handful of patients that we don't take.
I'll put you on the spot here. What about results with you? I mean,
with me personally, or with my practice?
With your practice. I mean, the results with the people that go on this machine.
Right.
That get a noticeable or big difference in quality of life, let's say, out of pain.
Yeah, I would say 80 to 90% of the patients that we put on get that kind of result. And again, they come in with varying levels of pain. So somebody that goes from a 5 to a 2 or a 1, it's not as dramatic of a difference as the person that comes in who is, I mean, they can't even sit in their chair there in so much pain. And this happens frequently because they've seen an advertisement or something and they come in again with hope, like I've tried it, everything, I can't take this anymore, do I need surgery? And I'm not opposed to surgery. We have some of the best surgeons in San Diego County, and we work with those guys. But they're not hot to do surgery either. They want to make sure that the patient's tried everything before they go in and do what they do so well. And the patient wants to try things too. And we're able to give them hope as well as a result. That's the main thing, is they're getting a result.
What are they afraid of, by the way? Anything about this machine?
Yeah, well, they're afraid it's going to hurt. I mean...
and it doesn't hurt?
No, it doesn't hurt. There may be some discomfort as you come off of a treatment because we've separated things and stretched things out, which is comforting, but as you stand up and your body weight begins to load back on, sometimes they're a little bit sore with that. And that's understandable, but everybody's able to get off the machine just fine. We walk them into the waiting room and put them on some ice for 10 minutes, and they're out the door, you know.
Okay, now what about follow-up treatments? I mean, are you forced? Is it one of those kind of things you got to do it forever?
Not really. It depends on the patient. The more degenerative changes there are in the patient's spine, the more likely they are to need some sort of follow-up. But as I mentioned earlier in the program, we transition some of these people onto a home traction device, which is not decompression, but what it allows them to do is to take pressure off at the end of each day. So it's not accumulating day after day, week after week, month after month.
For those patients that have these home traction devices, how is this far superior or totally different?
Well, in a number of ways. First of all, a lot of the patients that we see have tried traction. And again, traction cannot do what decompression does. So decompression, again...
So decompression is not just a fancy name for traction?
No, it's the technical term for creating this negative pressure.
Interesting, okay.
Which draws this fluid in. So the big difference is that traction is nonspecific. And so it just kind of stretches the whole spine. Yeah, it stretches the whole thing. And eventually with traction, what happens is you pull too hard, muscles start to engage, and you start to create spasming. So they end up in more discomfort than they get relief. So,
are you not a big fan of traction as a first?
As a first line, absolutely not.
Okay.
I'm not a fan of it. I think there's other things that are more effective that you can try, even leading up to decompression. You can try manipulation, you can try exercise and things like that. But if you have a herniated disc, chiropractic care can be somewhat effective, but because I'm a chiropractor, I've been doing this for 18 years, we've treated lots of herniated discs, but I can do more with this than I could ever do with my hands. It's just
What's the hardest thing for people, or for you to get across to a patient? Just that it works? To get them to believe this?
I think that's part of it. I think for them to get them to understand how it works, and we're pretty good at explaining it. We've got plenty of time with a patient. We can take the time and show them results, show them some of the things that other patients have written about it who were also very skeptical when they came in, yet walked away changed in a very positive way. And so I think it's gaining confidence is probably what they want to understand. They want to know that I'm a good guy, that they could work with me. They walk in and my staff is just unreal. They are very caring.
Everybody says they have a good staff.
Well, I got to tell you, people walk into my office that don't have appointments. There are patients that are patients, but they don't have an appointment that day, and they just pop in and talk to my office manager. And it's, I mean, I love that. That's great.
Okay. We're going to take a quick break. We come back, more about how it works, and how soon somebody can expect to see results. And I want you to take me through the process.
Okay.
Somebody on day one, your evaluation, how you decide whether they're candidates.
Right.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about spinal decompression, a new procedure, and we're here with Dr. Blanchard that is getting a lot of attention lately because of the results he's getting with his patients. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Blanchard. We're talking about spinal decompression. What about a patient that's older and they're fragile and they say, I'm too fragile, or my mother's too fragile?
Well, in some cases they are. If a patient has advanced osteoporosis, then we are not going to put them on that machine because their bones are brittle, and there's some risks to that. But we can measure that with the bone density test if the patient doesn't already have that. So people will often ask, am I too old? Is this going to hurt me? And it's not about being too old. It's about you can be too fragile, but you can't be too old. I think we've had the oldest person we had on there was 86
So an 86-year-old,
years old.
And I mean all 86-year-olds are fragile.
No, they're really not. No,
Okay.
no. I mean, you might think of them as fragile because they move slowly, but from a physical standpoint and a mechanical standpoint, some of those people are very hardy.
Now we mentioned at the top of the show sciatica. I guess that's pain going down the leg.
Yes.
And neck pain.
Right.
How is that? I mean, how does this machine that's dealing with the back help those areas?
Well, those pains, it does. And the pains that are going away from the spine down a limb, like your leg, or from your neck out your arm, the reason that's happening is because the nerves that come away from the spine are irritated, either by pressure or by the chemical situation of injury. Generally, it's a combination of the two. So with this device, by restoring motion and bringing fluid into the disc,
The body heals itself?
well, yeah, it creates an environment where the disc can heal. We often see on an MRI a torn disc, where they call it an annular tear. And that's not a good thing. But what they've, again, shown on pre and post MRIs is that the annular tear has begun to heal as a result of this process.
So the science. Okay, so you could show this, you're saying, on an MRI?
Yes.
Like a before and after?
Yes.
So it does work?
Yeah.
Now these pain patients that come in, I mean, are they more men than women?
I would say, yeah, more men than women, and more low.
Is that right? Interesting.
Yeah, and more lower back than neck. And I'm not sure why that is, because
So you want more neck patients with neck pain?
Well, we have the ability to treat those patients, and I think they're less aware of this than the low back patients, because what you see out in the media is all about low back pain. You never see a special story on neck pain. But those patients are suffering more, in most cases, than the low back patient. The thing is that you can get around with neck pain, but when your low back is gone, you can't function at all. So I think that's why
So the neck pain crowd, are they more skeptical, harder to get to?
I don't think.
What's your take on it? Why aren't they going in?
Well, I don't think they're more skeptical. I think, again, the media, as it portrays this device and this technology, is always talking about the lower back. And there's most
Is it great for necks?
It's fantastic. It does exactly the same thing, and frankly, it's a little easier to treat, in my opinion, because the head sitting on the neck is less weight than the upper body sitting on the lower back. So we're not dealing as much with a re-weighting issue after treatment when we're dealing with the neck.
Now, are the patients that are looking to your practice?
Yeah.
Is it a younger style patient? Is it an older patient? Are you getting more of the older patients?
We're starting to see more and more older patients. If you walked into a crowd of people in their 60s to 80s, 90% of them are going to have some back pain. and a lot of them aren't addressing it at all because they're able to live with it. But there's a select group of those people that are really having a hard time. And we're beginning to see more and more of those people because the people now don't want to sit around. You know, it's like we used to think, well, let's retire and we'll just sit in the rocking chair with our, with a pipe. Well, that's not happening anymore. As people age now, they want to be active into their 60s and their 70s.
Okay.
And I feel that way. I mean, I've got young kids and I'm almost 50. By the time they're in high school, I'm going to be starting to get old.
Okay.
And I want to be able to run around and do stuff with them.
Do you have those stories where people are back to function? They couldn't play tennis, now they're playing tennis. They couldn't golf, now they're golfing.
Yeah.
Or whatever.
Well, for example, a personal trainer came in, and this guy, for a living, he shows people fitness and how to stay fit and to be functional. And he was completely dysfunctional. So he had injured himself in a sailing accident. The hull was out of the water. You know how they lean off the edge to keep the weight, keep the boat level. And I guess the boat pitched, and he got pitched and went head first right into the sail, which was going into the water because the boat was capsizing. And when there's wind in a sail, it's hard as a rock. And needless to say, he thrashed his neck and a good portion of his spine in the process. And so for years, he had been very dysfunctional and having a tough time working, and it was getting worse and worse. He came in, we finally got him on the machine. He went through the 20 visits, and he was back to doing what he loved to do, which is being an example to people of how to function and how to be strong and fit.
Okay, now this is obviously a news story.
Yeah.
Do you get frustrated sometimes where you say, if more people knew about this, I wish I had my 5 minutes on the local news. If they knew how good this works, how well it works,
right,
more people would be coming in.
There's no question, and that is very frustrating. And again, another reason why I'm here doing things like this is to get the word out that this is available and it works. And
so what is your main message then, somebody watching this, about spinal decompression? Because we're just about out of time.
That it should be the first line option for herniated discs, bulging discs, facet syndrome, which is another irritation in the spine. For those three things, it is by far the most effective and least invasive thing that you can do. And it works. Statistically, 86% in relieving pain and 94% in restoring function. And those are documented statistics. There's nothing better.
Okay. Somebody, they want to know more.
Right.
They go to your website, a lot of information there.
Yeah. Well, you said yourself that this show's about options. So they can come to the website and get information there. That will link up to an email to me. They can ask me questions over the internet. Our contact information's there. They can call us. I'm happy to get on the phone with people and speak with them directly, which we do a lot of because they're skeptical. They won't even schedule, and the staff says, Dr. Blanchard, here's another one. And so I get them on the phone, and once they talk to me and have a better understanding, then they schedule. And it's just, we need people to come in and look at it. There's no obligation to follow through if you don't want to follow through, but it's once you see what this is and how it works and how comfortable it is and how well it works, people will do it.
So know your options. Day one, what happens? You go in, okay, somebody brings in, I guess, a stack of their images, or maybe they come in with nothing.
Yeah.
What happens first, and how soon can you start treatment?
Well, they come in, we get a very thorough history. They fill out some paperwork, which is typical, and then I bring them back in and I meet with them personally and get their history as it relates to this condition that they're concerned about. Once we've got that done, oftentimes they'll show up with MRIs and x-rays. We'll review those, and with the MRI and the x-ray as well as their history, I can determine right then and there whether they're a good candidate or not. And that's what people want to know. They want to know, is this going to work? Am I a good candidate? And we can tell them that they are or they're not. And if they're not, we have other options.
So you tell some people you're not a good candidate for that.
Absolutely. I mean, because we don't want to give false hope either.
How has this changed your job and what you do in your practice?
Well, I would say results, for one thing. I've been at this for 18 years, and I thought we had it all nailed down. I thought we had everything covered in terms of treatment options with what we did. And I saw this technology, and I began to investigate it. And I was skeptical. I thought, this can't be. I mean, it can't be that good. I went and saw the device. I got on the device myself. I could feel literally what it did and how it did it. And just based with my education, I could understand it anatomically, what it was doing. And a light bulb went on. It was just like, this makes so much sense that I got to do this. So we invested and did it. And since then, it's allowed me to treat a whole category of patient that I was relatively successful with in providing some pain control. But now we're talking pain relief. We're talking pain gone in a lot of cases, and really turning lives around in a huge way that we weren't doing before. We were managing it before, but now we're changing lives.
Now give us a recap, and we really are out of time, of the different type of pain patients that this works for.
Well, first in a general sense, somebody with neck or back pain that doesn't have an understanding of why they have that pain. They can come in, we can evaluate it, determine what the cause of the pain is, and then determine what treatment option is correct. Certainly people with a herniated disc, a bulging disc, facet syndrome, sciatica, arm pain coming from the neck pain, any of those patients could be a viable candidate for this process if the pain is coming from the disc or the joints in the spine. That's what this thing treats very effectively, much better than anything that I've seen to this point.
Okay, great. I want to thank you for coming on the show. Very, very interesting.
Good. I'm glad to be here.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.